Are you looking into Medicare supplement plans but concerned about potential risks? In this video, I'm going to talk about all the potential risks and downsides to Medicare supplement plans. Hey guys, Alex Wender here, founder of Blue Wave Insurance Services, where we help folks across the country with their Medicare and retirement needs. So Medicare supplements, also known as Medigap plans, are the best options for coverage and freedom, but there are some drawbacks, and we'll talk about that in this video. The biggest drawbacks on the Medigap plans come with the price you pay for the plan, the rate increases that happen over time, and the underwriting requirements that are in most states. In addition, Medigap plans do not cover dental, vision, or prescription coverage, so that must be purchased separately in addition to having the supplement plan. As far as rate increases go, it really depends on the state you're in and the carrier you're with, but typically we're going to see rate increases anywhere from 0 to 5% per year. Now, this can go higher depending on the year and what's going on in the industry as far as claims and inflation. But we do tell our clients to expect a rate increase each year, and if you're healthy enough, we can shop your plan and move you to a lower rate if one's available in your state with a different carrier. So rate increases are definitely a drawback on the supplement plans, and we do have a lot of discussions with our clients about ongoing rate increases and what we can do about them. Also, I mentioned the prices. Medicare supplement plans do come with a monthly premium that is in addition to your Medicare Part B premium that you pay the government. Now, depending on where you live and what carrier you're with, someone turning 65 should expect anywhere from $80 to $120 per month for a Plan G or N. Now, these premiums tend to be higher if you're in a state like Florida or New York, where premiums for Medigap plans in those two states tend to be a lot higher than the rest of the country. Now let's talk about underwriting. There are underwriting requirements in most states to change Medicare supplement plans. Underwriting consists of basic yes or no health questions and a check on which medications you've taken in the past. The carriers use this information when they decide if they're going to accept you or decline you altogether. So it is possible to be stuck on a Medigap plan and unable to change to a lower premium. But you could change from a supplement to an Advantage plan without any health questions, so that's still an option regardless of your health. Medical underwriting on Medigap plans is state dependent. There are states like New York and Connecticut that have no underwriting at all in their Medigap plans, and other states such as California, Nevada, Missouri, Washington, and others that have either a birthday rule or an anniversary rule, or essentially a rule that allows folks in their state who have an existing Medigap plan to change from one carrier to another without any health questions. So folks in those states can change without any risk of being declined. If you happen to live in a state where there is no birthday rule or anniversary rule, then it is possible to be stuck with a carrier if your health does not allow you to change to a different carrier to take advantage of a lower premium that might be available. Another potential risk is choosing the wrong supplement plan during your initial enrollment period when you do not have to answer any health questions. If you were to purchase the wrong plan, such as a high deductible Plan G, thinking it was a regular Plan G, and your initial enrollment period is over to change plans without health underwriting, it is possible to get stuck on the high deductible Plan G. So overall, the risks are the price, the rate increases, and underwriting, and potentially making the wrong plan decision during your open enrollment period for Medigap. But the Medigap plans do offer the most coverage and the most freedom, as you can see any doctor in the country that takes Medicare without a referral. So at the end of the day, you do pay for what you get. The plans do cost a premium, but you do get the best coverage. If you are looking to compare Medigap plans, please give us a call at the number below or use the link in the description to book an appointment with us. We are looking forward to working with you. If you enjoyed this video, please hit the like and subscribe button below to stay updated on all things Medicare. Thank you for watching. Take care.